I know the whole House will join me in sending our best wishes to Her Majesty the Queen for a full and swift recovery. It is a reminder that this virus has not gone away. But because of the efforts we've made as a country over the past 2 years, we can now deal with it in a very different way, moving from government restrictions to personal responsibility. So we protect ourselves without losing our liberties, and maintaining our contingent capabilities so we can respond rapidly to any new variant. And while the pandemic is not over, we have now passed the peak of the Omicron wave, with cases falling, hospitalisations in England now fewer than 10,000 and still falling, and the link between infection and severe disease substantially weakened. Over 71% of all adults are now boosted in England, including 93% of those aged 70 and over. As we have throughout the past 2 years, we will continue to work closely with the devolved administrations as they decide how to take forward their own plans. And today's strategy shows how we will structure our approach in England around 4 principles. First, we will remove all remaining domestic restrictions in law. From this Thursday, 24th of February, we will end the legal requirement to self-isolate following a positive test. And so we will also end self-isolation support payments, although COVID provisions for statutory sick pay can still be claimed for a further month. We will end routine contact tracing and no longer ask fully vaccinated close contacts and those under 18 to test daily for 7 days. And we will remove the legal requirement for close contacts who are not fully vaccinated to self-isolate. Until the 1st of April, we will still advise people who test positive to stay at home, but after that, we will encourage people with COVID-19 symptoms to exercise personal responsibility, just as we encourage people who may have flu to be considerate to others. Mr. Speaker, it's only because levels of immunity are so high and deaths are now, if anything, below where you would normally expect for this time of year, that we can lift these restrictions. And it's only because we know Omicron is less severe that testing for Omicron, on the colossal scale we've been doing, is much less important and much less valuable in preventing serious illness. We should be proud that the UK has established the biggest testing programme per person of any large country in the world. This came at vast cost. The test, trace and isolation budget in 2020-2021 exceeded the entire budget of the Home Office. It cost a further £15.7 billion in this financial year and £2 billion in January alone at the height of the Omicron wave. We must now scale this back. From today, we're removing the guidance for staff and students in most education and childcare settings to undertake twice-weekly asymptomatic testing. And from the 1st of April, when winter is over and the virus will spread less easily, we will end free symptomatic and asymptomatic testing for the general public. We will continue to provide free symptomatic tests to the oldest age groups and those most vulnerable to COVID. And in line with the practice in many other countries, we're working with retailers to ensure that everyone who wants to can buy a test. From April the 1st, we will also no longer recommend the use of voluntary COVID status certification, although the NHS app will continue to allow people to indicate their vaccination status for international travel. Mr. Speaker, the government will also expire all temporary provisions of the Coronavirus Act. Yes. And today we're taking further action to guard against a possible resurgence of the virus, accepting JCVI advice for a new spring booster offered to those aged 75 and older, to older care home residents and those over 12 who are immunosuppressed.